Hello, I'm Tabitha Mullis. I'm one of the nurse practitioners at Dublin, Macon Cardiology. For the purpose of the video, I'm going to put my mask down. I have been at Dublin, Macon Cardiology since March of 2020. I am a resident of Lawrence County. I grew up in Lawrence County, went to West Lawrence High School here, graduated from Middle Georgia. Also went through Georgia Southern and Walden University to get my master's in nurse practitioner. I've been a practicing nurse practitioner for 6 years now, with a diversity in family health, urgent care, and now cardiology. I would like to take a moment and speak with the community about what we have been dealing with here in Lawrence County. COVID-19 started in March, basically, around our area, and has had its ebbs and flows of patients affected with it. Here recently, we've been seeing some increased numbers in our COVID-19. I would just suggest to the community that you continue wearing your mask, you do your social distancing. If you sneeze or cough in a tissue, not in your hands. Use your hand washing skills, probably more than you used to. Hand sanitizer when you don't have soap and water. If you have a cough or cold or sniffles, any shortness of breath, loss of taste and smell, we are telling our patients to get tested for COVID-19. Please do not just assume that it's a common cold or allergies. Even though we still have common colds and allergies, we want to make sure that everyone is taken care of appropriately. If you are having a medical emergency, then call your local 911 and get to the emergency room as soon as possible. Here at Dublin Macon Cardiology, we are seeing an increased number of complications of COVID-19. There has been a lot of question about the vaccination for COVID-19. There are 2 different vaccinations, and the only contraindication that we have been seen by the CDC is a severe allergic reaction to the vaccination would be your only contraindication at this point. We are advising our high-risk patients, or our cardiology patients, to receive the vaccination. We advise all of our patients to continue doing their follow-up visits. If you experience shortness of breath or chest pain after having COVID-19, we do want to see you in the office and evaluate you. We are seeing a lot of new onset of atrial fibrillation, coronary artery disease. So please be aware of the side effects of COVID-19. We are happy to treat you here at Dublin Macon Cardiology. We just really want patients to understand not to put off your healthcare visits because of the pandemic. We understand that you are scared and you don't want to go out in the community, and we are very sensitive to that. Please call our office with any questions or concerns that you may have, and we'll be glad to talk to you over the phone. If we feel like you need a visit, then we will schedule you a visit. This virus was thought to be just a lung disease that attacked the lungs, but that is not the evidence that has been proven now. With this virus, it attaches to an enzyme that enters through our lungs, and there's other areas in our body where that enzyme will actually attach to as well, and that's the GI tract, that is the lining of the blood vessels, which we're seeing why we're having blood clots after having COVID-19. So if you have blood clotting in the lining of your blood vessels, then you can see a pulmonary embolism, you can see clotting in the arteries of the heart, which is causing heart attacks. So please be aware of these complications with COVID-19. I would also encourage you, if you have had the COVID-19 virus, that you really consider donating your plasma, because the plasma is saving patients' lives right now. If you are unsure if you are a donor, then you could reach out to your primary care physician or your local Red Cross, and they can provide that information for you. I too as well have had COVID-19 from working in the hospital with Dr. Vega doing patient rounds. I was exposed, even wearing the correct PPE, which is a lot more than what you are wearing in your community. I still contracted the virus, and it's very important that you take this very seriously and use precautions. I know a lot of our community members do take it seriously, but I also know there are several that are not taking it very seriously. Remember, if you are not one that has a lot of medical problems, you can still carry the virus to someone that does. So it's important that you not only think of yourself, but you're thinking of your community members as well. If you need us, we are here for you 24 hours a day, 7 days a week at Dublin Macon Cardiology. We want you to have cardiac care that is close to home.